Hi, I'm Dr. Eric Mazer. Our Ask the Doctor question for today is, what is minimally invasive valve surgery? On the set with us today is our expert, Dr. Richard Kaplon. He's Section Chief of Cardiothoracic Surgery at Danbury Hospital. Richard, minimally invasive valve surgery, it seems almost science fiction-y to me. How can you replace a heart valve way in the chest minimally invasively?
So defining minimally invasive valve surgery, or minimally invasive surgery in general, really speaks to changing the incisions that we historically used and making them smaller. So you take a cut this big dividing the breastbone and you make it smaller this way. Or you go through the sides, you don't have to divide a bone at all. In our current evolution, for many of the valves we replace, we actually do it with a needle through the groin. But the idea of minimally invasive is trying to figure out how to affect the best care for our patients without needing to beat them up quite so much and do the damage that we historically have had to do to access the heart valves.
And that seems like a story about surgeons in general. The surgical process, which used to be about enormous cuts, and is really now about this elegant, targeted invasiveness, which I think is just magnificent. Tell us a little bit about the valve surgery itself. The Tavr, I guess, is the one that's out there. Tell us about Tavr.
So Tavr is specifically for the aortic valve. Tavr stands for Transcutaneous Aortic Valve Replacement. Historically, we would have had to divide the breastbone to replace the aortic valve. That incision evolved to cutting a window in the breastbone. In its most common evolution, and this is not for all patients, but for many patients, in its most current evolution, Tavr is about replacing the aortic valve by placing a needle in the artery in the groin, passing a guide wire up that artery, and then placing the valve over that guide wire.
So the valve actually goes from the groin to the heart and then is expanded and put into the heart.
Exactly.
Permanently. It's amazing. It's amazing that somebody came up with this and that it works and it works better. Unfortunately, that's all we have time for. Thank you so much. I want to thank Dr. Kaplon, as I just did, for joining us on the set today. And you can share your comments and questions with us by emailing us at healthtalk@newvancehealth.org. We love to hear from you.